having Achilles tendinopathy or tendonitis or having just some pain in the backside of your foot is very common from a basketball standpoint. A lot of basketball players are logging in a ton of hours each week, each month on their lower body. And basketball is one of those things where, it's a 12-month sport. And because of the nature of basketball, athletes are really using that Achilles tendon to explosively move laterally, change direction, jump up. So that is a common area where athletes are getting injured. So I'm going to walk you through some basic progressions that you can do if you're someone that's dealing with Achilles. All right, the first thing we're going to do is you're going to loosen up some soft tissue in the calf. Now, understand that if you have some chronic issues in the Achilles, you don't want to really attack that with soft tissue or stretching because it's like if you have a scab. If you have a scab, you don't want to pick it. So if you're having some chronic pain in your Achilles area, don't stretch, don't do soft tissue work because that could aggravate it more. So this is where you may want to go distal from the issue. So here, I'm going to do a calf smash, and you can use a foam roller as well. I'm going to take this kettlebell, and I'm just going to move left to right as I loosen up that calf. If I find a tight area, I'm going to do some ankle pumps. And I'm going to go left to right, try to find some of these tight areas. And I may go lower, but again, if you feel that discomfort, you're going to stay away from there. But you're just going to loosen up that calf because you're probably going to have to improve some ankle mobility as well. So that's going to be that calf smash. It's going to be the first soft tissue movement that you want to do. All right, the next one is going to loosen up your calves from a mobility standpoint. So what you're going to do is I have a physio ball. You can also use a bouncy ball or a foam roller, I'm sorry. So you're going to put this against the wall, and you're going to put your feet on the wall as well, and you're going to scooch in your butt as close as you can. And now from here, you're going to pull your toes down. As I pull my toes down, I'm going to push my hips up. And then as I push my hips up, I'm pulling my toes down further, and I'm going to slowly drop my butt and tailbone to the ground. So you should really feel a stretch in your calf. Same thing, hips up, and then lower. Hips up, and then lower again, and really hold that stretch where the toes are pulling back to get the calves. So I push my hips up, feet go to the sky, pull my toes down as far as I can to the shin, and then try to exhale and keep the toes pulled back to the shin as my butt gets lower. And I'll do this for anywhere from, I might do 2 sets of 5 and then rest after each set. I might do 1 set of 10. We're going to do that till you really feel your calves loosen up. And that'll be another great movement that can help improve. So the next movement I'm going to do, we're going to do a wall sit, wall strider, 90-90 wall sit, wall strider. So I'm going to put both feet on a wall. I'm going to try to drag my heels down to feel my hamstring. Tailbone slightly comes up, and I'm going to do a bridge and lift 1 foot off the wall. And I'm going to do a nice, easy calf raise. So this will connect that calf and that hamstring. So when I really begin to do some, plyometrics, I'm building that calf strength. And ideally, you want to be able to do this without pain. If you feel pain, you stay away from this, and I'll show you 2 regressions if this one's going to cause you pain. So I'm going to do a few calf raises, so probably do 10 to 15 each leg. So I do a bridge, and now I'm going to do calf raises. So I'm really strengthening that calf, connecting it with the hamstring. So this will be another great strength exercise if you're someone dealing with some. Another great way to strengthen your calves and improve Achilles tendonitis or tendinopathy is going to be doing some form of a calf raise. So first I like to do isometric. So what you can do is you can get a plate, you can even do this on the ground, and you're just going to do a slight calf raise. Nothing too crazy, going to get on that midfoot, and I'm going to hang out here and hold. I'm going to hold that for, try to get 30 to 45 seconds, just enough where I feel the calf burning versus the Achilles, right? So if that's causing you issues, what you can do is press up on both, and then you're going to lean more towards the foot that's bothering you. So if it's my right, I'm going to lean more towards that right foot. Okay, so once you're able to do, 2 to 3 sets of a 30 to 45 second isometric calf raise, then we're eccentric calf raises. So that might mean that, I'm going to press up on both and then slowly lower. Same thing, press up on both, slowly lower, press up, slowly lower. And again, if that single leg eccentric calf raise bothers you, you just go both legs and you're going to put a little bit more weight on the side that bothers you most. And that third one would be our calf raises under control. Once you progress from your isometric, your eccentric, and then your concentric based calf raises, that'll be a great progression to build back that strength. And this could be something that you progress every 2 to 3 days, and or you do 2 to 3 workouts with isometrics, and then the next week you do your eccentrics, and then the next week you do your concentric based calf raises. So while dealing with your Achilles issue, it's important that you still strengthen the other surrounding, the supporting cast of your body. Right, your Achilles hurts, but understand that your body's going to work in synergy. Quads, hamstring, glutes, everything's going to work as you take a step, plantar flex, dorsal flex, get that calf working and triggering up the body. So I really like doing front foot elevated movements because they can improve the ankle dorsal flexion, which you're probably limited in, hence where you're getting more stress when you toe off. Hence where the Achilles is really firing up because you're just not absorbing force appropriately enough. So I like to do front foot elevated split squats. So I'm going to show you 2 variations. The first one is a front foot elevated split squat where I'll put one foot on, and here I'm going to give a nice slight rotation to really loosen up the hips, and I'm going to drop straight down. Right, so I want to find that hamstring, so I'm trying to drag that foot back to find that hamstring to build some quad and hamstring, synergistic movement. As I come up, same thing, and you can load it if it's appropriate. So I'll build up and do that once a week, 3 sets of 8 to 10 reps at a 3-second tempo. The next one is going to be an HEG split squat. So this is where I'm going to elevate that foot. I may hold 2 dumbbells, and I'm going to glide forward. Because this way I'm going to improve that ankle dorsal flexion. Now these movements are going to be done once that Achilles is feeling better, once that chronic pain has lightened up, once that inflammation has reduced. So again, I'm here, coming down, coming down, coming down, coming back up, coming down, coming back up. And you notice I'm still getting good hip flex stretch. I'm keeping that chest vertical, driving that knee forward. Okay, so if I hold weight, right, I'm not going to lean forward, keeping that chest vertical, right? So this is a great way to improve ankle dorsal flexion, improve hip mobility, build strength around the quad, really help the glute and hamstring work as I'm pushing into that ankle dorsal flexion, which could ultimately improve your normal movement when you're on the basketball court. So last but not least, 2 exercises that will be great for you to really get better prepared for, high impact sport like basketball. The first one is going to be a front foot elevated pogo hop. So what I'm going to do is I'm going to elevate my foot and I'm just going to bounce off that front leg, right? Because it's going to help that tibia move appropriately. It's not going to be as impactful when I land on that front leg versus just doing some pogo hops. So same thing, I'll be here and I'm jumping. And if that bothers you, what I may have athletes do is just oscillate. You're just going to do some oscillations in this position to really get that Achilles tendon to rapidly load, really work on that stretch shortening cycle that's going to improve or help you move effectively on the basketball court. So again, you're just going to do some hops. Right, I may do 10 reps the first workout and then build up to 20 seconds or 30 seconds because in a basketball game you're going nonstop. So once that feels comfortable from 2 to 3 sets of 10 to 20 reps or 10 to 30 seconds, I'll progress to a rear foot elevated pogo hop. So here I'm going to elevate that back foot and now I'm going to jump. Right, so this is more of a propulsive movement that's really going to improve the foot's capacity to handle every step you take on a basketball court. So if I go here so you can see, so I'm going to be here and now I'm going to jump. Right, that's going to help build the capacity to handle every time you toe off, every time you land, every time you explode up to the rim. So these are 2 great plyo exercises that you can do to get your ankle, your Achilles better prepared for basketball if you're someone dealing with some injuries.